Sir Edwin Chadwick was a vital figure for sanitary reforms in London during the 19th century, paving the way for public health and improving urban living conditions. Born in 1801 in Manchester, United Kingdom, Edwin's exhibition began during the industrialization and urbanization in England. The Chadwick name quickly correlated with the war for improved sanitation, living conditions, and overall well-being of the exponentially expanding urban population. His pursuit of sanitary reforms is still extremely influential to everyday life 200 years later. Without the work of Sir Edwin Chadwick, the world will still be living in squalor.
24 days after the turn of the century, a young boy in Longsight, near Manchester, was born. His name was Edwin Chadwick, son of James Chadwick, and his destiny, unknown at the time, was to forever change the future of public health. His early education came from his hometown, attending school in Longsight and Stockport. When he was 10 years of age, his family moved to London, just as countless others were doing at the time, and Edwin began receiving private education, which would lead him to becoming a lawyer. He was also a journalist, writing for the Morning Herald, which helped him develop literacy skills which would prove useful later in his life. Through his articles, Chadwick developed what he called the sanitary idea. This would be his first expedition into the world of public health.
Prior to the 1800s revolutionary advancements of sanitary reforms made by Sir Edwin Chadwick, the extent of collective knowledge was minimal, and little public action was taken to improve conditions. The miasma theory was heavily accepted as the cause of disease. Society believed that disease was spread by foul air. People thought that epidemics emanated from rotten organic matter, and with a society plagued by excrement-filled streets without a solution, the public health was in dire threat. With the miasma theory in mind, sewage was dumped into the Thames River, extensively polluting the water and causing many people to become ill.
His first foray into the true workings of public health and improvement was the passing of the 1834 Poor Law, which was highly criticized, seemingly punishing poor people for their conditions instead of helping them. In 1839, Chadwick realized a large number of people who were being admitted to the poorhouses he helped create in 1834 and attempted to fix this problem. The 1839 Sanitary Commission helped improve the conditions of workers, which would hopefully, according to Chadwick, help lower the amount of people on relief. Again in 1847, he spearheaded a commission to separate drainage and sewage systems, which was a glaring public health problem. His writings and evidence gathered about the state of public health spurred the creation of the Public Health Act of 1848, in which the government gained responsibility to hold the public health standard of the community to higher levels. Chadwick's work to develop this act gave him the spot of commissioner on the Board of Health. His work's influence cannot be understated. He prevented countless deaths and illnesses because of these sanitary regulations. His sanitary ideas were even used during the Crimean War to aid the troops. Chadwick laid the infrastructure for public health and would forever influence generations above him about the prevention of infectious disease.
Although we know Edwin Chadwick as a pioneer in sanitary reforms and public health, he could not escape the popular beliefs of his time. Chadwick and his companions believed that disease emanated through foul air, later known as the miasma theory. As modern science has proven, the miasma theory is no longer creditable. As a result, Chadwick supported the dumping of sewage into the Thames River. Even though this action eliminated the sewage contaminating the street, it resulted in contamination. The amount of impurity discharged from the sewers was calculated from the amount of deposit known to have been formed in the several of them. The amount of impurity in the Thames would therefore be at the least double that calculated from the scene. The amount of sewage accumulated in the Thames River was colossal. The contaminated water sparked illness in the people comparable to the effects of the sewage on the streets. Not long after Chadwick corrected his prior beliefs, revolutionizing sanitary reforms that succeeded him.
Edwin Chadwick's work in public health in London and the United Kingdom shaped the structure that our current public health follows. His forward-thinking and elite scientific mind allowed him to discover safer ways of living in the mid-19th century, which are still guidelines for our current public health decisions. Before his advances were listened to, the ideas surrounding public health were very wrong and caused many premature deaths of British citizens. From the 1834 Poor Law to the late 1860s, Chadwick worked tirelessly to help change how people lived. He passed numerous laws and reform bills that slowly but surely reshaped the landscape of public health forever. These inspired others in different countries and continents to take the same measures towards their public health, and the world slowly morphed into a cleaner and smarter place. His work for the public health of London changed the way that public health would forever be treated and led to a better planet.